Hello, it's lunchtime live again, Wednesday, it's 12:30. I'm trying this from my phone for the first time today. If you guys are watching this, you know that I've been trying to figure out the tech. So I'll watch the video later and see how it worked. The last couple of weeks, I've been doing this for 2 weeks now, the last couple of weeks I've had a lot of questions related to dilators. So we talked about the best positions to use dilators in. We also talked about different types of dilators and why would you pick one over the other and kind of generalities about why you would use one. But I thought we would switch gears today because we had our first meetup of my mom's run club, which we're doing here in Aventura, Florida, and we're doing it once a month only. It's just kind of a nice way to have moms get together. It's just going for a jog together, bring the babies, whatever. But I think it's kind of perfect because I'm a pelvic floor PT and I'm co-hosting with the urogynecologist, who's absolutely amazing, and a lot of new moms and also grandmoms. So we've got like the postpartum group, but we've got the menopausal age group. Both of those age groups can sometimes have difficulty with impact exercise or sports, for example, running, jumping, and also sort of in the same vein, coughing, sneezing, laughing might have some leakage. And our group is a perfect way for moms to get into impact exercise and have access to us to ask questions. And we got some really great questions. So one question I received at the very end was about leaking with coughing and sneezing, and then also she mentioned while we were running. And I think it wasn't actually true leaking. She wasn't sure if she was actually leaking urine, but she had the urge to go. She felt like she couldn't control it when she was having those moments of exertion or impact. And that's really common. It's not normal. It's treatable, but it's super common. There's entire rows in the drugstore now dedicated to incontinence pads and liners and all these different things. So I wanted to just relay my answer to her because I think it's a common problem and probably a lot of people are wondering the same thing. And I do think that it's a barrier to participation when it comes to athletics and exercise, which is really so important for us. I mean, cardiovascular exercise, amazing for mental health and really good for our hormones. Resistance exercise, super important for building muscle mass, keeping our metabolism up, building bone density, and that's important for women as we age, but just in general. So eliminating barriers to participation in athletics and fitness, to me, I think is pretty important. So let's talk about what you can do if you're leaking when you cough or you sneeze. Obviously, the first thing, you should come see a pelvic floor PT and get assessed. But what if you don't have time for that or you don't have access to somebody? The most common, and this is not the only reason that people have leaking, and I don't want you to presume it's your reason because you could be different, we're all unique, but the most common reason that I see women leaking either in the postpartum stage, for me postpartum is like up to 2 years after having your baby. I don't mean 4, 6, 8 weeks only. And also in the menopausal time, perimenopause, menopause, and postmenopausal. The number one reason that I see for leaking when coughing, sneezing, or doing impact activities like running is pelvic floor weakness, and at the same time in coordination with the other muscles of the deep core, because the pelvic floor, you cannot dissect it from the rest of your body. It functions together with all the other muscles, very importantly with some of the deepest core muscles, your abdominal muscles, and they should work together to control the pressure in your pelvis and your abdomen, so that when you have a strong cough or sneeze or a strong contraction or an impact, that the pressure is managed and the pee doesn't squeeze out, or the poo doesn't squeeze out. Some people have that problem too. So the first thing, if you were just going to be on your own doing this at home, you didn't go to a pelvic PT, you didn't see your gynecologist, you just thought, I got this little bit of an issue, I want to work on it myself, is pelvic floor strengthening exercises. And thank goodness for the internet, there's a ton of information on that now. Some of it's really, really good, some of it's not that great. Again, that's why I recommend coming in to see somebody like me, but not everybody can do that. So you want to work on strengthening, and the easiest way to do that is just figure out how to contract your pelvic floor, which are the muscles that control pee, poo, and contribute to sexual function and support your organs. They're the muscles where your underwear touches, in the saddle region, like if you were sitting on a horse saddle, it's the muscles right there at the groin around your vulva. So you would work on finding those muscles to contract them, and then making sure that after the contract you relax completely, and that's commonly known as a Kegel. I don't love that term, but it's a pelvic floor muscle contraction and relaxation, and that's the simplest way to strengthen, is just to find it and use it and do repetitions. There is so much more to pelvic floor strengthening and deep core coordination than that, but if we're talking super basics, find your pelvic floor, contract and relax, and do repetitions to wake it up and to start to strengthen it. Again, this is not everybody's problem. Some people, many people in fact, that come to see me are too tight. They're actually leaking because the muscles are so tense they can't actually do their job. So please don't assume that Kegels are the answer to your issues, but if you gotta start somewhere and you gotta pick something to do, that's one really good starting place if weakness is your issue. So Kegels, or pelvic floor contractions, contracting and relaxing, learning to activate those muscles, getting them a little bit more conditioned and a little bit more in shape and a little bit more responsive. And again, I kind of sound like a broken record. It's tough for me because I'm used to seeing people one-on-one and I can give all these really detailed instructions and do my full assessment, but there's so much more to deep core and pelvic floor strengthening than just Kegels. But for the sake of simplicity, it's a good place to start. So that's one. In the meantime, there are things that you can do to help support your bladder and your urethra as you are strengthening, as you are gaining that strength, because just like trying to run a marathon, just like trying to get stronger in the gym, strengthening your pelvic floor muscles does take time and consistency and repetition. But in the meantime, if you'd like to be exercising, there are ways to help support. So the easiest way is to just use a tampon. Why does that work? When you insert the tampon, it gives like a little bit of splinting pressure as it expands to sort of support the vaginal wall and the structures around it. And for many women, this helps them control leaking. It is not plugging up your urethra. It is not absorbing the urine. I've heard people kind of have this idea about that's why the tampon helps them. If a tampon helps you, for example, when you're running or coughing or sneezing, it's because it's acting like, you know, like when you put arch supports in your shoes and to support your arch, it's just like a little mechanical splint that lifts you up a little bit. And a tampon does that for your bladder and your urethra. It's a really easy starting place. Obviously, you don't want to wear a tampon all day. You want to wear it when you need it and then take it out. So I suggest that only in cases if you're going to be doing some sort of very particular finite bout of exercise and you don't want to leak. There are other more specific options if the tampon isn't quite enough for you. So for example, all right, so we got the tampon. Actually, this one wasn't great. This was like a little compact, and I found that it really wasn't big enough to give support, interestingly. This is probably a bad example. This is a product by Poise, who makes a ton of incontinence products. They're making a ton of money off of weak pelvic floors. But if you need it, it's here, so that's good. This is a disposable pessary. A pessary is a device. It's exactly like we were just talking about. It's like an arch support that you would put in your shoe. It's a support for your bladder and your urethra that you insert vaginally. And in the past, the only way to get a pessary was to go to either a pelvic floor PT or a urogynecologist and get fitted and have one that I have some around here. I don't think I have one in the office. The treatment room is in use right now, otherwise I'd go grab it for you. But in the past, pessaries were made of kind of a firm plastic, almost like a diaphragm, like you would use for birth control back in the day. I don't know if they still use those for that. And you fold it up, insert it all the way up into the vagina, it pops open, and then supports from the inside. And it provided a lot of support, and it helps a lot of women, and I still recommend it all the time for people with higher levels of prolapse but don't want to have surgery. This is much more accessible, right? Like you can just literally go to Walgreens or Target and buy these. It looks like a massive tampon, and actually really cool, this comes in different sizes. So this is a size 2, but I think they have several different levels. It's got a string just like a tampon. This is disposable, not reusable, and you can see the size difference. It's much thicker than a tampon. So if a tampon seems to help but isn't quite enough, you could try something like this. You insert it just like a tampon. You could put a little lubricant on the tip if that would be helpful for you, if you're concerned about discomfort. And then you push it out. And you can see that it expands in a very particular way all the way up inside your vagina to provide support to the urethra and the bladder. And just for a size comparison, and certainly tampons do expand with moisture, but we're assuming when you're not using this for menstruation, so there's not going to be a ton of moisture. You can see how much more this would expand. And it has like this little springy support in it. Okay, if you do have something like vaginismus or dyspareunia, which is pain with insertion or pain with sex, I definitely recommend using a lubricant to insert this, and maybe even reapplying a lubricant with your finger around it before pulling it out, because actually pulling out for people with pain with penetration, pulling out is actually worse than inserting, and we could talk about that another day. So this is the Poise Impressa bladder supports. We're talking about levels of support that you can use while you are strengthening and coordinating your pelvic floor and your deep core to prevent leaking. We've got level 1 tampon. Another option is something like this. It's a disposable pessary. A third option is, this is Revive. It's a reusable bladder support, but it is not disposable. This is reusable. And it comes in a package that looks like this. You have to put it together yourself, so I thought I would put it together for you live so you can see how it works. This piece is what's going to eventually pop open inside you to support the bladder and the urethra. You insert it. It functions exactly like a tampon. They're all inserted the same way. And honestly, this is so much more convenient to insert than a traditional pessary. So I hope they come up with something for the traditional pessaries that's similar to this. So I'm feeding the string through here. And it works exactly the same way. You can use a lubricant. You would insert this into your vagina all the way to here, holding here. And then you push it through, and this is inserted up into the pelvis and pops open to support, and this pulls out. It does come with replacement strings. If the strings get dirty or once you use them, you do want to replace them, but this is washable and you can use it over and over and over again. And both of these products say you can use them for up to 12 hours. So yeah, that's what we talked about at the Run Club, which is if you're having leaking and you want to get back into fitness, you don't want to be leaking with coughing and sneezing, the number one thing is let's get the system right and actually heal your pelvic floor. And for a lot of people, that does involve strengthening and coordinating the pelvic floor. Once again, not for everybody, but for a lot of people. And in the meantime, if you do want to be active and you're working on strengthening, some of these pessary options or replacements could be helpful so that you can be as active as you want to be and not be leaking in the process of strengthening along the way. So I hope that was helpful. I don't see any questions or comments. I will repost this so you can watch it later in case you missed us live. That's a royal us, it's just me. I would love questions. I would love feedback. I'm doing this every week on Wednesdays at 12:30, and I will see you next week.